Great. Okay. Hi, everyone. So I am live now, and we just have to get it started soon once I have Dr. Yusuf come on. Awesome. So if I have my team members here, I think I see Ada. Please, can we just ping Doc to join so that we can start? Hi everyone, good to have you here. It's been a minute since I've done a live. I think I did one like last year around this time. So quite exciting. I get very animated and very expressive, so I'm looking forward to it. I think it's a really, really useful topic. So awesome. Hi, Rame. Hi, everyone. We're still waiting. Maybe I guess I'm not a traditional what's the African time? African timer is on standby. No, waiting for me. No, I think he has to request. It has to request to join. Okay. So what handle? So he has to request to join. So if you can just request to join, that would be awesome. So you can go on, because I can invite him, but what's it called? What's his username? For example, he can join in this live and I can just add him on there, or you can actually request to join. So I'm not with my phone, so I can't chat. If you're chatting with me, I can't. Obviously, I'm using my phone to do Instagram live, so I wouldn't know. So he needs to definitely be on here, so I can add him on. Awesome. Ah, great.
Hi.
So I have to invite. I think there's a double two-edged whatever sword. I can either invite you, or you can be on there and request to join. So I just invited you. Chat. Hi. I wasn't sure if it was going to be directly your personal account or whatnot. I didn't want to mess it up, but it's good to have you on. Hello.
Hello. Good evening. Good evening, One Else Farm. Good evening, New Childcare Farm.
Your childcare. Hi. Awesome. So it looks like you're calling in all the way from
the UK. Leicester.
from the UK. It's good for us to just share. Thank you. How are the chocolates and the biscuits? Anyhow, any digital methods to send some to us? No.
I don't know why everybody seems to associate abroad with just
not abroad. The UK.
The UK. Okay.
Specifically, the shortbread is very important.
That's fine.
Right. Awesome. So I think maybe we'll give it just a couple. Maybe we'll start at 6:05 straight, or we can just start now. Either way, and just keep the ball rolling. So hi everyone. I guess it's good to have you here. I'm Adeola Ali. I'm the CEO and founder of One Health. One Health is an online pharmacy and healthcare platform. We are building a digital infrastructure to make healthcare accessible for all. So we talk about medicines, lab, and obviously doctor consultations. That's why we have Dr. Yusuf here from New Child Care. So I mean, this week, every year we celebrate World Immunization Week, and really it's just to highlight the importance and the collective action that all stakeholders are taking to ensure that people of all ages are vaccinated. But today we are niching in on childcare vaccination, because I was doing my research, and thankfully, I mean, you're able to really join in this conversation because it's declining, right? And when I look at my own me as evidence, I actually go back and go like, actually, have I missed the dose? I mean, you'll be surprised that even the people that should know better, right? You know, it
Yeah.
just slips through the cracks. So it's evident that wherever you are, we need to stay vigilant, right? So obviously, I'm just going to introduce you, obviously, to the audience, right? So we have Dr. Yusuf Shiti here. He's a medical doctor and a social innovator. He's extremely passionate about investing in the future of Nigerian childcare by improving the access to quality and affordable healthcare and mentorship through innovative initiatives. So good to have you here.
Thank you.
I'm
Thank you
just
for
going to
having me.
go ahead.
So thank you for having me. Yes.
Awesome. So I'm going to give a background again, some just more stats that I have on here. So according to WHO's report in 2017, and that was the earliest, I mean, the latest I could find, about 77% of children between the ages 12 and 23 months in Nigeria did not receive any routine immunization, right? And immunization coverage for preventative vaccines, right? I guess preventative vaccines like vaccinatable diseases between like the 36 states varies dramatically from 80% in like maybe Lagos states to about 3% in Sokoto, and it's still below the recommended global goal of 90% in any state, right? Even Lagos, right? The global goal is 90%.
Yeah.
And although Nigeria has made like great strides in reducing deaths of under 5-year-olds, right now we have like it's reduced from 158 to about 120 per 1,000 births, but really during that same period the routine vaccinations have dropped. So I'll go over to you now. I've done all the talking I want to do. It's going to be you to tell us everything. What is going on with vaccinations and immunization in childcare? Like why have you seen that decline, routine vaccinations?
Well, there are a couple of factors, obviously, and to be very fair, I don't know if how much it means to the current audience in terms of the stats. Yeah.
It's like they don't care is what you're saying.
Yeah.
It's not for them.
So I would assume that those people on the call now and are probably not among the people that would necessarily benefit from being aware of that, because there are obviously a lot of factors. You've got the socioeconomic divide. You've got this wide disparity between the rich and the poor. You've got low level of education. You've got traditional norms. You've got people that have beliefs that are obviously tied to their culture, their tradition, and and that unfortunately affects a lot of the health outcomes for children, right? So and exactly explains why some people, especially in some areas in the north, where there are some cultural biases against immunization, why you'd find such a low uptake. So generally, it has always been a struggle with Nigeria, right? Attaining those targets that we're supposed to attain, because accessibility generally is poor, and there are a lot of factors that as some of which I've already highlighted. Aside those, there's also the barrier, even when someone is willing to get themselves vaccinated, even when they are aware, even when they're on Instagram and they know they have data, there's still that tendency or that probability that they might miss one or two vaccines. And you see, so on that flip side, you see some factors such as the lack of time, right? Parents having to work 9 to 5, always hustling. They need to literally take time off work before they can actually make a vaccine appointment. It's not like they don't care about their child, but then, they might forget, they might miss it, they might not be reminded. That's one. Two is just the fact that some people don't even know what vaccines they're supposed to be giving to their children, right? And some of the factors that are to blame here would be the wide disparity between various immunization charts, you see. So and it all depends on where you give birth. So if you are fortunate to give birth in a hospital, that the immunization schedule is comprehensive, including all of the vaccines vaccinations or
All over the
vaccines.
world, right?
So there's a wide disparity, right? So, and immunization, unfortunately, is localized to a particular country, right, or a particular region, and it's supposed to be targeted and focused at the diseases that are endemic in a particular region. Yeah. So you find that. So one thing that I've even found is that with our own experience dealing with immunizations is that even people that give birth abroad can be found defaulting right on their children's vaccine.
I mean, I'll come
Because
and
they
talk about
come
my
from
own case. Yeah.
yeah
Yeah, go ahead.
because they've come from the US where there's nothing like BCG or there's nothing like rotavirus or whatever, and they come with that foreign feeling like that is the superior vaccine card because it's from the abroad, so to say. And then they come here, they already don't even know, they don't have an idea what they call. So we find a lot of people in those shoes as well. So you see these multi-factors. Aside time, aside disparity in region, you see location, accessibility is also a big factor, right? And these, when you want to think about even going to a hospital to vaccinate, it already stresses you because you're thinking of the long queues that you have to endure before you're able to get your child vaccinated. You're thinking of, oh, is it the nearest health center? And is the nearest center do you even trust that they would do this? They would, give these vaccines in a professional way? Are you sure that these vaccines are in absolute cold chain? Health center that is close to your house that probably has not had light in a long time. There are a lot of factors. You see, so unfortunately, it's there's a lot of work that needs to continue to be, that we need to continue to do to improve that access, to sort of knock out all of these barriers, and obviously we'll talk a lot about that as we go along.
Fantastic. So I'm just going to piggyback off of some points that you just made, right? Number one, first of all, like you have different schedules and different regions. So there's no harmonization on data on even what they've taken from where they are coming from, possibly, and to what they should be, using right now. So, let me just even stick to, even in Nigeria, we talked about the hustling mom that forgot to vaccinate their child. And in my head, I'm like, I know that in the States or in the UK, your GP is assigned to you. You probably get like a letter in the post. In fact, those people, they can even sue yourself. Like you won't go to school without all of those things. So why, I guess, is the burden, and please educate me. I know some answer, but I want to be very clear. Is the burden on the parent in entirety to fully see the schedule and the vaccination to completion in Nigeria?
Obviously, the burden in Nigeria is on everybody's on their own in Nigeria. We're all on our own.
So,
in Nigeria, you're on your own.
When a child, when a mother gives birth to a baby, when that baby goes home, that's it, right? It's up to the mother to say, I want to book an appointment with my, I don't know, primary healthcare center
In many cases, some hospitals are good where they make appointments for these vaccinations. They give dates, right, for the next vaccine appointment, and they make sure, but in terms of giving vaccination reminders, I'm not too sure how many do, right? But then it is not, unlike for instance here in the UK, the child is your child though, but also the government is actively involved in ensuring that you take care of. They don't just leave you to take care of this child. They know that you can be crazy too. You can decide not to take care of your child. You just brought this child to this world, right? But the government is actively involved. But unfortunately, it's not the same, and it's not the same in Nigeria, and it's the same with every other thing, right? You do your own power, do your own water supply, everything. So we're not averse to. It's not something new, right? So but what I think what is important here is for there to be a system that or for mothers at least, to take up that onus and more responsibility to be more inquisitive, to be more vigilant, to be more alert. It's not just that. I don't think many mothers, at least in many of the categories that I've interacted with, right? It's not that they intentionally would decide to forget because of work or because they're too busy. But sometimes they don't. They are not. They've not paid, or they've not gotten enough help with the immunization, because obviously it's a lot.
Right.
There are
So they know,
different
but
immunizations. There are
okay.
different vaccinations. There are different schedules. So, and there are some vaccines that are considered optional, so to say. Whereas I wonder where that idea of being optional comes from. Right? There's the Nigerian immunization schedule that obviously covers some vaccines, right? But covers it not and obviously leaves out some others, not because they are not important, but because there's no donor funding to support them being on the on the schedule. So there are a lot of factors. It's not just one angle.
Wait, okay. So do they have this card? Because I remember then, like we had like our own. In fact, I had to take it with me, like 1980, whatever card was this green
Yeah,
card, the
yeah,
vaccination.
I had that too as well.
Do they still
Yeah.
have that?
So not everybody gets that. Some people
Okay.
get what their private hospital gives them, or
Okay.
what. So it's not generally uniform. In the UK, you've got the green part, the red book, right?
Mm-hmm.
That every child gets, no matter where they are born, right? So I think it used to be uniform, right? But I don't think it is any longer, and that is creating a really, really big level of confusion. There's so many immunization schedules going around. The one from the
Even in
private
Nigeria,
hospital
no, they so
in
or do we have
Nigeria.
like a gold standard in Nigeria or not? No, really, not really.
So we have a national immunization program, and obviously even extended to mean the extended immunization program in Nigeria. It was recently reviewed by the National Primary Healthcare Board, right? Um, and some vaccines were added onto that schedule much recently, right? But that is ideally supposed to be the uniform one that that all children should at least be getting. That's the schedule they're supposed to be following. Those are the minimum number of vaccines that they should be getting. But unfortunately, that vaccine schedule itself is not comprehensive enough and doesn't meet WHO standards.
Ah, I see.
Can you
So you're
see?
saying eventually, even if they have
So even
this
if they have that
protocol,
green one, right, it is still not enough, because private hospitals that know what they are doing would have done a more comprehensive one that follows the WHO recommendations. So I'll give you an instance. Pentavalent vaccine, which is the 5-in-1 vaccine that mothers get, that children get in infancy, right? It contains 5 vaccines in one. Ideally, by WHO recommendations, after those 3 doses in infancy, they're supposed to get boosters of the pentavalent between age 2 to 3, age 4 to 7, and age 9 to 15, right? So 3 boosters, ideally, or a minimum of 2. But the immunization schedule does not provide for that. And what exactly is the consequence here? The vaccine, actually, the immunity wanes off after 4 years. So you find a lot of 5, 6-year-old children that are playing all around that are not immune to tetanus, for instance, which is one of the vaccines in the 5-in-1 pentavalent vaccine. So you see, what that does is eventually they can come down with tetanus and die, unfortunately, because their national immunization schedule does not provide for that. And I'll tell you, that's one of the experiences that set me up on my journey to founding Neo Childcare. Whilst I was I was doing my internship in Luz. 2 children on 2 consecutive night shifts died from tetanus because they were not immune, because they were aged above 10, and they had obviously received the immunization in childhood, but in infancy, but they didn't get those boosters. And they didn't even know they should be getting those boosters because the immunization schedule does not provide for that. So that's one of the reasons why we're deeply invested in sort of redefining access to all vaccines and ensuring that we're able to eliminate all vaccine preventable diseases and we get the numbers down to as much as close to 0 as possible. So it's absolutely crucial that mothers also take responsibility, because we can't leave it to the government in Nigeria.
Absolutely. Okay, so do you know if there anything that they're doing about this whole, like at least giving everyone some national card, or not really?
So to be fair, I'm not very aware of of whether or not there are initiatives to give people a uniform card, but that also misses the point, in that the schedule itself needs to cater to more vaccines, needs to be, and vaccinations in Nigeria should not be totally donor funded, or should not only depend on donor funding, because that's exactly what is the case. So rotavirus, for instance, because we don't have donor funding for it, mothers have to pay for it, right? A lot of all the other vaccines that are quite important, and mumps, measles, and rubella, MMR, is also very important. It's not covered under the schedule. So you see that there's a long way to go till we're able to reach those targets that we should be reaching with immunization.
Okay, fantastic. Thank you so much for that. So my follow-on question is, so obviously to answer this and to solve this, right, after this, we're going to be sharing like a recommended schedule, right? Because obviously what we're saying, that knowledge gap is there, that
Yeah,
even if we have a national immunization schedule, there's some things that are missing in there.
yeah,
There's some
yeah,
doses or some vaccines that are missing.
yeah,
And so we absolutely need to push that out there and ensure that everyone has that information, right?
yeah, yeah.
But secondly, right, I do have a lot of people that they already say they've eradicated that there's herd immunity. The ones that are a little bit more advanced that understand it. How true is that? Is there a need to still vaccinate if it's already kind of eradicated and maybe you've had a couple of doses and it's not a big deal? So what's the need to fully complete the dose? I mean, you already touched upon like tetanus, right? But do you want to add on to that, the herd immunity excuse?
Oh, that is it. The one that mothers give, or I'm not very
So a lot of
clear.
people give excuses that okay, they've eradicated. Oh, polio is gone already, or partly
So
gone.
why do we need to vaccinate against polio?
Do
We
you
got
understand?
to
Or measles,
Yeah.
no
So
measles.
so
So
the
why?
thing the thing with
Like,
immunity,
yeah.
yeah, the thing with immunity, and we've seen it with COVID as well. For instance, that's the easiest example that we can get, right? Especially with vaccines that are focused on viruses, and the tendency for viruses to mutate and change, right? There is always that need to keep a good level of herd immunity within the general populace, right? So even if polio has been eradicated, the moment we drop vaccinations against polio, means that the immunity of many people in the general populace, that eventually, so the concept of herd immunity is that if we're 100 people in a country, right, and 90 people get vaccinated, the 10 people, because 90 people have actually been vaccinated, and that's a good number, the chances that diseases would easily be passed around within those 100 people is lesser. It doesn't mean that the 10 people that didn't vaccinate themselves cannot get the disease.
Yeah.
That's
So,
not
but the
that's what people
excuse is
need to
that I
get
want to
right.
be 10 people because
Yeah,
I
so if
forgot to do with the
everybody, if
side
the 10
effects.
people, then there wouldn't be anybody
Be a
that is
90.
vaccinated, and there wouldn't be any herd immunity, right? And
Yeah.
the concept of herd immunity is not to excuse you from getting vaccinated, right? The concept is basically telling you that there's a lower chance, because everyone has done their part. Most people have done their part. So if polio has been eradicated, there are many times we've said polio has been eradicated, but then you hear
Not
again that there is a
somebody.
wild polio strain somewhere
Oh, yeah.
discovered in Sokoto or whatnot. That's because even with those news, whilst we are jubilating, people are dropping the immunization levels, so people are not turning up for their vaccines. The
Absolutely.
uptake is getting lower and lower, and the lower it is, the less herd immunity we have, and the more likely that we can have situations where there would be mutations to the virus or whatever it is the disease is. So that's exactly the concept and how it works. So generally, I would implore every mom or everyone that's watching really to not to focus on that. I know that there are a lot of people that are averse to vaccines or that have one fear or the other with regards to vaccinations, and hopefully we'll be able to delve in and talk a bit about all of those.
Okay, so let's delve in and talk about that. So what are the myths? Obviously, we've heard about autism, right, and several others, and even this COVID vaccine. Although we don't have that in them here now, kids. But what are the general myths that we want to debunk right now in terms of vaccination that's prevented some people from getting it?
Well, obviously you've spoken about one of the common ones. Unfortunately, it's still one that just keeps and I funny enough, I think the more we talk about it, the more people get doubtful about whether or not the information is correct, or we're trying to lie to them. But the thing with autism and vaccinations, obviously, is something we've said over and over and over and over, that it has no basis scientifically. And the person that published the article pulled it off eventually and retracted that publication because it had no scientific basis, right? So, and I think people associated it with is it the MMR vaccine or whatever? But then it there's so many people that have gotten the vaccination, and it had no connection whatsoever with autism. So I don't want anyone to watch this live and still believe
And
that,
so go like,
right?
there's no smoke without fire,
Yeah,
and then
there's no
go and
smart, and then
think,
everybody keeps. The
yeah,
truth is that there are people that have a lot of reason to doubt vaccinations or to feel like they probably do not need it. But the truth is, um, vaccines have done a lot to reduce preventable deaths globally, and this is not new. And
absolutely.
there are a lot of diseases that we've been able to eradicate just because of the vaccinations of these vaccines, right? So
Absolutely.
first off, um, a lot of people are worried about, aside all of those myths around, some people are worried about government wanting to reduce the population and using that as a means to inject people with microchips or whatever it is they want to keep. I've actually had a personal experience where we're going to vaccinate a school, and I'm actually going to do it as CSR, right? It was a low cost school, and we're going to vaccinate them against tetanus, and we're going to do it as part of CSR, right? And we got this backlash from the parents of the kids that they don't want to, that maybe this is one way that the government wants to use to reduce the poor people in Nigeria. Unfortunately, we cannot be in control of what people think. All we can do as health professionals is just to keep speaking truth to power and keep saying exactly what we know based on the facts. The truth is, every vaccine that is produced undergoes serious scrutiny, right, before it gets into the market. There's a long time, not just about the time, it's even the process, right, between when the science behind the vaccine is developed and when it eventually goes through all the regulatory barriers before it can become commercially available. Healthcare is one of the most regulated sectors, right? And if anyone wants to do anything, and that's one of the barriers we face in healthcare as well, because when you want to do anything new, because it deals with human lives, there's generally the first thing is there's always that aversion first. There's always that regulatory barrier that you need to surmount. So that means that before these vaccines make it to the shelf, they've gone through a lot of quality control, quality checks, right? And so you have no reason whatsoever, right, especially because you are not the only one in the world receiving these vaccines. Millions and millions of people have received this vaccine. I understand with COVID, a lot of people were skeptical, especially with the speed and all of those, right? It's okay to be skeptical. What is not okay is for you to see facts and still choose to be anxious, or choose not just to believe the facts that are in front of you, right? So yeah.
So, but you know that there's no medication without some form of side effects, right? So we've talked about the ones that were really huge, but what are the side effects of it? Even if it's minor or somewhat major, what are the things that people should look out for? For example, if they go get vaccinated, are there specific ones? Are they general ones? What could they be?
Yeah. So the thing is, and I think it helps if we help us understand what exactly happens when you get vaccinated in the first
Thank you.
place.
Yeah. All right.
Right. So what you are trying to do with any vaccine is to is to show your body an example of what a threat to your body can look like. And what you mean, and I think the easiest example is, I think we posted a cartoon on that on our page, and it got a lot of engagement because it was very simple to understand. But imagine you've got a set of soldiers that obviously do not know what a thief looks like. Right? They don't know what a thief looks like, right? And you definitely need the soldiers to fight for you when the time comes. So a vaccine is basically introducing an armless mode or form of that thief, a thief that probably doesn't have any weapons or cannot do anything, such that they see the sort of threat that this can pose, and they understand to mobilize more soldiers or police officers to deal with this threat should it arise again. So if you are leaving your child to, yes, there's the option to leave your child to develop immunity naturally, right? What you are probably going to do in that case would be to allow the insult or the foreign agent or the infection to overpower the body's immune system before they are able to now respond. The truth is, some children might be able to do that, right? Children have very fragile immunities, right? But the truth is, you can't leave that to chance. There are so many children that have died just because they were exposed for the first time to a particular illness, and their immune system could not deal with it. And the best example is what happened with COVID. See how many people were dying at the beginning of COVID all over the world. Is it the same thing now?
I'm on mute. We're not paying 50K anymore.
Is it the same thing now, right?
Thank God, hallelujah.
The numbers were flying up and down because the vaccination we didn't know, our bodies didn't know how to react to this or respond to this.
Yeah, absolutely.
If anything whatsoever should have taught us a lesson about vaccine access, and I'm speaking to the
You make a solid point.
Yeah, now
you make a solid point. Absolutely.
If anything, it is COVID, because it showed us that if we don't have immunity to an infection or a virus or bacteria, whatever, it can overpower our system and it can kill you. Literally, can actually kill you, whether you are young or old or whatever, right? But the moment you are able to get the vaccination levels highest, you can defeat. Now, with the deaths are really, really lower now globally, and it shows obviously we are winning the fight against the illness with vaccines. So
So to the question of minor side effects, right?
Yes. So
because
you
always want to, because one thing
yes.
the trick that I found, especially when you want to get people to use their medication, there's just something from a farmer side, because they always stick to the really major ones that are probably wrong, and not saying the minor ones that will probably happen. and mitigating for that. So I want us to know what could, be
what could possibly happen, right?
Yes, that in reality, as okay, yes, this could possibly happen.
The worst thing, right? The worst thing, whatever that can happen if you get vaccinated, is that your child develops a reaction to it.
Okay.
And the reaction that you develop to it, right, differs on many levels, and it depends individually on the child's immune system. It depends on the formulation of the vaccines and whether or not your child is allergic to any of the contents or the other adjuncts or things that are used to formulate the vaccine. So at the very best is what we call anaphylaxis, where there's a total shutdown of the immune system, where you generally develop a full-blown reaction to. So that's at the very worst. The truth is that it is very, 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 very rare that any of that would happen.
Right? And also, it's not unique to vaccines. Everybody.
And it is not unique to vaccines, because this can happen to when you take any medication that you have an allergy to. It can happen when you are exposed to something that either is grass or food item that you take that does not agree. Fortunately, in Africa, I think in Nigeria, I speak for Nigeria, we tend to have less allergies compared to, a lot of people in other climes. In the UK, you see a lot of people with so many, an allergy list so long, with so many different things and different, from food to grass to whatever.
Like, why is that? How come?
There's obviously there's a lot to understand from our genetic makeup. We are already used to, I think, from our genetic makeup, our environment. Yeah, we're already used to hustle life. Exactly. So the situation is already tough. Imagine, and one of the things that we're yet to even understand about our immune system is, for instance, the impact of malaria on our immune system, on how it helps our body be on alert for other illnesses. Maybe that's one of the reasons why we didn't get COVID so bad. We'll get to that another time.
People will tell you that people died then, though. We just didn't know that it was COVID. We just don't have that data. I really hope that next time anything like this happens, like, we're equipped for data collection.
To be able to do that. So to go to your question, with regards to the side effects, one of the things that we expect would be fever. We'd expect fever. We can expect some redness and pain around the area. We can expect some swelling. We can expect that the child can develop mild symptoms of the illness itself. It's not to mean that they got the vaccine, the illness. But it is even to show that the vaccine was effective in generating a response from your. So there's a difference between vaccination and immunization. Vaccination is the process where I take a needle injection and I inject it with the vaccine. Immunization is your body's innate response to that vaccine, generating antibodies and soldiers that will help you fight that infection at a later date, right? That is immunization.
So are there instances where you get vaccinated but not immunized?
Yes. Okay.
So how do you know? How would you know? In Nigeria, is it like we've not reached that level to test the level of antibodies?
So the truth is, so how would you know, right? One of the things, unfortunately, with vaccinations, one of the things that causes that disparity between, a situation where you have someone being vaccinated, not immunized, when there's the vaccine that you're giving is not potent, probably wasn't delivered in absolute
cold chain and everything,
in the recommended temperatures, right? If you have a vaccine developed, delivered or injected, or you are vaccinated with that sort of vaccine that is not potent, you won't generate a response, because what is supposed to generate that response is already dead. Do you understand? What is dead shall never die.
And would you say that might be happening a lot? So even this rate of vaccination that we are talking about, we can divide it by 2, because there's a potential that all of these vaccines are not being stored properly or even administered properly. So Is it a ticking time bomb kind of situation?
Exactly. So you are not even sure. One of the ways to know eventually, like objectively, there are tests that actually can be done to test the level of
Okay.
antibodies in the body to a particular illness. You see, when you want to travel abroad, or when you want to do a particular, maybe, some people that might need to do medical tests for a job abroad or whatnot, they usually have to do those tests to be sure that they've got the antibody levels to a significant amount. So, for instance, I would use my case for instance. When I first moved to the UK, I had to do some tests, and then I realized that I didn't have a sufficient level of
I'm
rubella, for
laughing at
instance.
you. But what
Of
rubella?
rubella,
Okay.
yeah. That's because I was only vaccinated with measles 1 and 2. I wasn't vaccinated with measles, mumps, and rubella, MMR,
MMR,
right?
yeah.
So I had to eventually get revaccinated all over again. So there are tests to eventually measure whether or not but it's of no use doing
Of
those
knowing
tests
you. So
when you
I
don't need
guess
to.
I'll then obviously this will lead to my next question as you're talking about this. So for a lot of us, me, I
Mm.
think I'm probably fully vaccinated because my mom was on point, but probably not everybody, right?
Yeah.
Is. And I can imagine that maybe I can point to some other of my siblings that maybe might have missed, and
Mm.
even kids that we're having right now that might have
Mm.
missed the dose or not, just based on moving up and down.
Mm.
Do you have a list that we can get after this call, or some form of information that can give us one where we can go and just go and check the schedule to see what we should have and revaccinate to get immunized? Two, how do we then keep this record, or do you have like database, or I don't know, an app of some sort? Like, what is the best way to
Right,
hold on
right,
to?
right. So
Because
see,
right now, you know me as a
so
tech entrepreneur,
I'm glad
solving
you asked this
problems with
question because
technology. In my head, I'm just thinking I'll have some form of tracker of some sort that
right. So
blockchain everything.
that is
But
exactly one of the reasons we founded Childcare, to be able to bring innovation to this space and to do things differently and to empower people with the knowledge they need to safeguard the health of their children, right? One of the things we do on a regular basis, almost every week, is to post a portion of the schedule and educate mothers.
okay,
Okay, this is, forget the national immunization schedule. This is what your child should actually be getting. What we found with that is a lot of mothers are becoming more aware. They are becoming more inquisitive. They don't just take their child to the hospital and then they collect the vaccine and someone signs that they don't even know what their child has taken in many cases. Now they are more aware, oh, this pentavalent actually contains this, and this, and it prevents against these illnesses, right? They know that okay, along with this vaccine, if I will go for a vaccination appointment, right? These are the things that you should get. If they miss out some, ask that why was this, because sometimes they give you the vaccine, they vaccinate you, right? When you go for the appointment, they vaccinate you. Maybe you go for, especially to the health centers where it's free, right? You go there, the vaccine tell you that one of the vaccines is already vaccinated, and that's it. Hello, are you there? Are you Hello? Can you hear me? I can't hear you. If you can hear me, I can't hear you. Unfortunately, I think your network is.
okay.
Yes.
Sorry.
Okay.
Go ahead. I think it
Okay.
was my
Okay.
connection. I'm not sure if it was mine or
Right.
yours, and then I stopped it. Yeah. Okay. Go ahead.
No,
Well, I'm
mine
like you're in
mine
the
was
UK, so
going
it's
was
probably not
going
your connection.
effortlessly. I think
It's
it's. Uh,
yeah, I know. It's like my. Continue.
and I think there
Really
is a
sorry about
lag.
that.
Because I
Oh.
think there's a lag. Yeah. But it's fine. It's fine. There's a lag between your
Okay.
audio and your
Okay.
video, but it's okay. I think it's getting better now. So what was I saying? I was saying that a lot of times, sometimes some vaccines can be out of stock and they don't tell you that this vaccine is out of stock, get it somewhere else, and they just literally just sign, and you think that your child is actually vaccinated against that, against all of those illnesses, and that's not the case. So that's the reason why we decided to launch our own vaccination service, right?
Okay.
To make it easier for us to determine, one, the vaccines that children receive, to be able to bring it to at a place of comfort, wherever it is at the time when it's convenient for the mother, right? And three, also be able to be able to educate mothers more, even if they don't utilize our service. But the fact that the child somewhere or a mother somewhere is more aware of the vaccine that they is enough, as is enough fulfillment for us. And like you said, we are taking that onus to also get mothers reminded about their vaccinations, to help them track it, to as soon as every vaccine round is completed, to help them help make sure that it is documented properly. They know the name of the vaccinator that vaccinated their child. They know the vaccine batch number, expiry date. All of that information is in the vaccination card that we create for them. And you know what this does is you're able to track. If anything goes wrong after the vaccine, you know who to call. You can always reach out to us. There's someone responsible, right? There's someone to hold accountable. If you are suspicious about something, or you are not comfortable, where we are actually going is and that's one of the things that we're developing with our app solution, that's in development currently. Is an immunization tracker, to be able to track the vaccines and get reminded and get suggestions about the sort of vaccines that you should be taking, when you should be taking
In
it,
fact, I want
when your child is due
yellow
for it.
fever card self from your app.
Is that?
Like, in fact, I want yellow fever card self. Like, I'll do the vaccine. I can do digital yellow fever. Please, when it's ready, let me know.
hopefully, but that's where we actually want to get to. And it's not just only immunizations, it's other aspects of child development that many people neglect. Is it milestones? Is it, many people are not even aware of the specific milestones their children are supposed to be attaining. All of those different things we need to help assist, because
We need it.
it's difficult
Yeah.
enough to be a parent, or to be an adult in Nigeria is difficult on one level. Now, to be a parent in Nigeria and trying to survive and feed your family, feed your child, is enough. So you need that help and support, and that's what we try to do at New Child Care. Yeah.
I mean, and that's one thing that I would say, like, the government is doing for most countries that we don't have, right?
Yeah.
Like, I remember I had to, till today, they gave me one book, because obviously we didn't have, like, I think it was BCG. It's usually BCG now that we don't do, like, abroad, right?
Yeah.
And some other doses and everything. So I had to go look for a hospital that does it. They didn't have the vaccines. And when they even brought it out, it was not looking, but I'm just like, hey, let me just give, just for the sake of, at least let them have something, even if it's not full. But today, I'm not really sure. And they gave me one exercise book that I cannot find anymore, right? Unlike other records, I'll just email one time, like, they just said everything. It's like a portal for all of that. So I really wonder, and we're really good if you can take this up. And obviously, if you need support, let us know. It's kind of like just integrate it with other systems as well. Because obviously, if it's just a new child product, then you want it to be anyone to be able to just send it over to other facilities for you to share that data on some form of blockchain or not. It will be so helpful, because it seems like that is the Achilles heel. That's that blockage, like just access to, am I supposed to take it? Starting to crack your head as to what they are due. Because when you go to the hospital, we'll be asking you, what did they take last? And you're now having to be cracking your head. It seems very complicated.
Absolutely.
It's very complicated. But okay, awesome. Because I know that obviously we have like around 10 minutes. So I have a couple other questions. And I want to, so I did ask for you to share the places to go. So you talked about most of these vaccines are funded, right? So which ones are funded, which ones aren't? how much are vaccines, like generally, right? If they're not funded at all, if you want to have, I'll say between that ages 1 to 5, say till they get into school, that's typically like the very crucial one. If you do not find, if all the vaccines disappeared, like nobody is funding anything, how much would it cost? Like, I want to roughly, how expensive are these vaccines?
Well, I would only be able to speak from our own point of view because we sell vaccines and we try to keep the prices as regulated as possible in terms of, because we're not in this to rip people off, right, or to rip mothers off. We're in this to also be able to improve that vaccine uptake. And if someone shows us, right, a source of vaccine that is free, if someone gives us a source today,
Let's talk.
I'm sure mothers on both our platforms will be able to enjoy.
So there's no free vaccine.
But,
so you don't have.
So vaccine, there's nothing in healthcare that is free, right?
Okay,
Vaccines are largely donor funded. So
Donor
you've got a lot of funding, World Bank, Bill and Melinda Gates, all of those things. They are funding the vaccines, most of the vaccines on the Nigerian immunization schedule. So what happens is these vaccines that are free are supplied, imported into the country, you know, as as part of donor funding and all of those things. They get into the government hospitals.
Okay.
Yeah, for free. And mothers can access those vaccines that are on immunization on the national immunization schedule at those health centers and a few private hospitals that requisite vaccines from the government. Not all private hospitals are able to do that. So only a few private hospitals normally on a regular basis collect vaccines from a central source. For instance, in a particular local government, the PHC there might be the hub for vaccines. And that's where all the private hospitals will get from, right? Or collect from. So that's one way. The thing with that is you get a lot of supply chain problems with that, in that when the source of the donor, the donor is not able to source the vaccine, or there is no supply. The vaccine are finished. It have finished. Yeah, try again next.
That's the end. Sorry, yeah.
That's the end. Sorry, madam.
Second dose.
Vaccine are finished. We don't have Penta again. The only one we have is this one.
Oh God!
So out of the immunization schedule, I think the only one that is paid for is rotavirus that doesn't come under donor funding. So that's the one that mothers are expected to pay out of pocket for, if it is available at the health center. That's only if it is also available. So the other way is obviously through private hospitals. So with private hospitals, you find that a lot of mothers are under HMO coverage. And with HMOs pay for the cost of the vaccines on behalf of their enrollees. Those vaccines in most of these private hospitals, if you go there, you have to pay for the vaccine to be administered. If you don't pay for the vaccine, you at least pay for the cost of the administration. Even if it was requisited.
So the coverage is covering the cost of vaccine. Even for the HMOs, the coverage is covering the cost of the vaccine, not the administration of the vaccine.
Both ways, and
so
HMOs do theirs in different ways. HMOs do that do theirs in different ways. In that, you know, they have ways they do capitation and all of those grammar. I won't delve into all of that because that will be beneficial to our audience. But the most important thing to know here is that surely vaccines can be expensive if they are not covered by any form of insurance or donor support or whatever. So to your question about the average, it depends on the amount of vaccines.
So everything. Say,
I
don't trust government coaching. I'm not saying that I trust. I don't say, guys, don't arrest me. I'm not saying that they are doing anything. I'm saying, I don't want to. I'm not sure about the just authenticity. I'm not sure about I guess
quality or whatever.
And I give birth to my child between 0 and 5. How much would I spend?
So I think we did the calculation one time because we're also looking into how we can make the cost more affordable, and we can help mothers actually break the cost of vaccines and be paying monthly. We're in early phases of discussions with a company that is looking into that, and we did the calculation of all of our vaccines and the cost of vaccinating, and it came down to about, is it 250?
250,000 naira.
Yes.
Ah,
So so it
this
came down to,
economy.
so
But
it
I guess
came
it's
back
over
to
5 years.
so it came down to about that.
That's a
At
lot.
least all of the vaccines that we expect, that WHO recommended, that the child receives. That's including the cost of our own. That's including the cost of our own home delivery service as well. So when you consider just the cost of the vaccine itself alone, then obviously it's a lot lesser than
It's a bigger
than
problem than I thought it was. Honestly, I thought it was a situation of, oh yeah, people just awareness, and once you just get everyone go get vaccines, everything is all kumbaya.
no.
But no, you're saying availability is still a problem.
Yeah.
Quality is still a problem.
Yeah.
Even knowledge of what to use is still a problem.
Yeah.
And tracking is still a problem.
Yeah. So there are loads of that. That's why I mentioned
Right.
to you yesterday when we were talking that there are lots of things to unravel, and I like the topic, your child's passport to good health, because that's essentially what we should all look at immunizations as, and we should be more conscious of the various aspects. And I hope with this discussion, all mothers or those that have joined so far have been able to piece together and see what exactly it looks like, even behind the scenes before your child can get vaccinated. So that awareness and these
Absolutely.
conversations are very important.
Yeah, I mean, obviously, if I start to ask her what steps, how many vaccines and whatnot, we'll just be here forever. Because, right, I know, like, we have someone asking about the step-by-step vaccines from age 0 to, I think I have Daphne, from age 0 to 5. So we're going to gather this information, but you want to talk
On
to
our
it a little
page,
bit?
from age 0 to 5, I can't. We
It's
can
a
be here
lot.
till tomorrow
Yeah.
if we go from here.
It's a lot.
Yeah, but on our page at New Child Care, you would be able to find amongst our recent posts or some of our posts, you find the immunization schedule, the one that we developed in line, taking into consideration. We basically merged the Nigeria immunization schedule and added on what is recommended by the WHO. It's not like we created this thing out of the blue. We did enough research to know exactly what is ideal. So you can find
what
that
we're going to do as
information
well
on
is
our
send a
page.
newsletter out. So we will try to include your schedule and give people the next steps as to if they want to, book you guys for what.
Yeah,
Now you're making this my passion.
No. Especially
as a mother and hearing all
yeah,
of this.
absolutely. Anyone
Absolutely
that's passionate about
important. Yeah.
universal health coverage, about public health, about health access, should be passionate and interested in immunization, because they are one of the vaccines are the single most important health discovery for centuries now, and it became evident even with COVID, because the whole world was turning upside down, and then we're waiting for vaccines to come and save us, and that's what looks like
And
it's
that's what
happening.
saved us. So for missed appointments as well, I guess that will also be in the schedule, right? Because it's not something that you can say, oh, where you missed appointment, this is the blanket thing for everything.
So it's a good question, and I think it's the one that we need to address. So when you miss an appointment for your vaccine, there are a couple of things to consider whether or not that vaccine is one out of a set of vaccines that you're supposed to take. Say, for instance, Penta, you're supposed to take 3 doses. And you've only gone for the first 2 doses. And then the next time you are probably remembering is 8 months after. That child is not fully vaccinated. You need to start again. Ideally, and it was the same with even COVID, right? We expect that there will be 4 to 12 weeks gap, 4 to 12 week gap between doses, so that you can maximize that immune response. You show the vaccine. It's just like you are showing your immune system the harmful material or insult in bits, right? You are showing it in bits to show, oh, you are okay, this is what it looks like. Oh, then you take it then they surmount a response, then you bring it again, and then you see that response is even greater, and then you bring it again, and then it's a fully aggravated,
full-blown response.
full-blown response. So if you don't follow up the vaccines in the right order or in good time, in good succession, the immune system forgets, because immunity wanes. Now we're talking about fourth booster of COVID,
that one is
because
old.
the immunity is waning. That's the truth. That's what it will do. It will keep waning, and we just we need to keep reminding our body about it. So that's very important. I recently, one of the mothers that approached us was asking if she had missed the first dose of, she had gotten the first dose of rotavirus, for instance, when the child was an infant, and then the child was already 21 months old, and she was like, she just discovered that she did not complete the vaccination. So if you don't complete, you need to restart, especially if the duration
send you
is
all
more
of
than
my
12 weeks.
Documentation, so that you guys will check everything for us. So I'm just adding my own.
Yes. We're happy, and the thing is, we also vet immunization cards. So if you are not sure or you don't even understand, you just need to message our hotline, send a copy of your vaccine card to us. We'll tell you the vaccines that are due, the vaccines that you've missed, and what you should be doing to get yourself to your immunity to an optimal level.
Absolutely. Thank you so much. I just want to make sure that I've covered within reason
Most of the things. Yeah, that's fine.
Yeah, most of the things. So we're skipping vaccination. Is it safe? Yeah, saving lives. Absolutely. Okay, so the next will be like next steps, right? So, and I'll just kind of just talk a little bit, just a closing statement. So next steps, I'll say for everyone asking or anyone asking us to, okay, fine. I did get some vaccinations because I was very excited as a mom when I gave birth to my baby. So first 2 months, I for sure. But from that age 2 to 5, I don't know, and you're trying to understand what's happening, you definitely can find us, myself, or Neo Child Care. Send us a message, right? That would definitely be the first thing to do. And let's see your card, and let's help you analyze what might be missing and book an appointment. Luckily, now that we're in a digital age, right? Pick up the phone, they'll come to you. Abi, that's how you guys work.
Yes,
absolutely.
Real life.
They'll come to you and give you a vaccination at home in the comfort of your couch as you're watching Netflix. So we actually, there's no excuse. So now my only thing now is not about the cost, right? Because not everyone's can afford 250K for in entirety. So are there any schemes, grants, are there any applications, or it's just a matter of just go to your health center?
At the moment, our vaccinations are covered under Reliance HMO. So if you're under Reliance HMO,
our joint
please message us, because obviously your HMO is one of the lucky ones that has responded to us. We've been knocking on all their doors, and our hope is that all your HMOs, and let me say this well off record, that all your HMOs, they consider your own safety and convenience.
Fantastic.
And not just their profit. So that is our hope, because we've approached quite a number of them, and we will not stop. We will keep, because our objective is to be able to do the work that we're doing, and to however it is we're able to get compensated in a good, in a reasonable way. We want to be able to keep doing the work we're doing, without having to necessarily be a financial burden on mothers. We understand that very clearly. I was just talking about what some of the things that we're also doing with helping you, considering ways by which mothers can pay small for these vaccines. You can pay monthly. You can drop it. It can be a direct debit.
We definitely need to think around that business model that will just make it not as cumbersome, burdensome on people.
Obviously, and as a business, we're not also you must actually get the vaccines from us, right? If you are sure of a particular
Healthcare
location where
center.
it is safe or whatever.
Do you know of any that can just drop names now? Let's just drop their name. What else? Which health center should they go to? I mean, because I'm like,
Unfortunately, I've
health
not been
centers are
paid
expensive
to do
now.
marketing for any one of them. So
No, it's public health now. It's public health that we are doing. We are doing God's work. We can just drop it there.
I know quite a number of children's hospitals.
Okay.
In recent times, I've seen a lot of mothers, because we also do wellness checks for mothers. And
Okay.
one of the things that we do for moms, for the children, and one of the things that we do is to analyze their immunization level.
Okay.
They look at their immunization cards. Have they been actually vaccinated up to date? So I noticed that a lot of the mothers that go to specialist children's hospitals, Lifeline, pediatric children's, all those sort of pediatric focus hospitals, they have systems in place to ensure that they have a more well-rounded vaccination schedule, and they make mothers aware. But to be honest, I can't put my neck on the line for many of the hospitals, and that's the reason why we're here. As you rightly said, our hope is to really complement the health system, rather than compete with other facilities. And definitely, as whatever it is that makes it easier for mothers to be able to access vaccination is what we're about.
Fantastic. Awesome. Okay, so let me just conclude right now. Thank you all so much for joining. Yeah. It was very, very, I always find this conversation so interesting, and we always repurpose the videos anyway. Yeah. That allows us to disseminate the information, because people are coming in and out, so I can see that, right?
Yeah.
So it's important, but this is so, personally, I felt that I learned a lot, and there's some things I'm going to go on. I'm a lecture woman. I'll give everybody will do round table. Look, where's your immunization card? Show me. Evidence. We're going to take their pictures now.
So that's your passport. Where's your
immunization card? That's what I do. I'm the chief compliance officer in our house. So
that's what it's supposed to be. Yeah,
and
every mother should be that way with the children. And it's not just about looking at this child and saying, "Oh, this child has grown up. That's the end. Let's not bother about it."
Yeah, and then even the adults as well, which I was going to talk about, but because this is the child's passport, I know there's some ones like they say, like TDAP, you're supposed to be taking like every 5 years, every 10 years, like I don't know, something like that, right? Yeah. And obviously, if you're exposed, if you're pregnant, so many of these things that we don't remember, but they would help us, and so for sure, immunization saves lives. Vaccines strengthen your child's immune system.
Absolutely.
All childhood diseases we vaccinate against can cause serious illnesses, so we need to absolutely do them because we don't want them to die or be really seriously ill, right? Skipping or delaying vaccinations puts your child and those around you at risk of contracting serious diseases. And immunization is a safe and effective way of giving protection against diseases such as whooping cough, measles, and several others, as we know. So as I just wrap up, I literally just copied and pasted this WHO. So I'm not plagiarizing, I'm amplifying.
It's important to amplify.
So all girls and boys, no matter where they live or what the situation is, have the right to survive and thrive, safe from deadly diseases. Vaccination acts as a shield, keeping families and communities safe. By vaccinating children, we are protecting the most vulnerable members of the communities. Millions of lives can be saved by extending basic healthcare services such as routine vaccinations and immunization. And to the most vulnerable disadvantaged children, immunization is one of the most powerful and the most cost-effective health intervention. So with that, gentlemen,
see, I didn't need to even read WHO to say that is one of the things I mentioned. So it is one of the most powerful, and you don't listen to any of the anti-vaxxers. All of those people that are spreading rumors, that are saying all sorts of things, please don't listen to them. Believe people like us that have no interest whatsoever other than in seeing you and your child healthy, right? Don't listen to people that just want to have an opinion and want to create pandemonium. I want to spread fear. I want to drag other people along with them into their doom. So please, that would be my take home message for everyone.
For sure. And 100%, we're going to send an email newsletter. We're going to post on our blog all of what we've talked about and links to materials. And for sure, you can reach out to Neo Childcare, or if you need any help to reaching them, well, I'm sure you can reach them easily.
Yeah.
But if you need any help around that, definitely let us know. Take it easy, and for sure, go check your immunization cards at home. Moms, dads, uncles,
yes.
aunties. Do that. It's very important. Today marks the last day of the week that we celebrate World Immunization Day, and we hope that it doesn't end here, the conversations. So have a great weekend.
You too, everyone. Thank you. Thank you so much,
Dr. Shiti. It was really great chatting.
It's a pleasure.
Right.
It's a pleasure.
Bye.
All right, then. Have a nice day.
You too. Bye.